Good morning, and I'm here just on a quick show to talk about the unfortunate and I think deaths are always untimely, so I'll say untimely death of Harry Belafonte. He was a singer, actor, and activist. He's dead at the age of 96. This came up on my feed, and some of my friends also reached out to notify me. And as my typical approach to these things are one, I want to say, my condolences go to his family. May he rest in peace. I've, as a child, knew about, Harry Belafonte, and the movies that he played in and the like. And so he's a major loss to the world. He was also an activist, very active in the civil rights movement. But the reason I want to talk to you today is the issue of congestive heart failure. And as my custom approach to these things are, when someone happens to be famous or someone notable, has a health condition that is very common, I like to use that as an opportunity to inform the public. Many people are probably, asking questions about congestive heart failure and the like. So what I'd like to do today is, give you some insight, about congestive heart failure. What is it? What are signs and symptoms of congestive heart failure? Now, many of you may think immediately, well, at the age of 96, the heart just gives out. And, eventually, we will all die, and hopefully most of us will live to the ripe old age of, 96 or 106 or 126 for that matter. But congestive heart failure isn't a normal condition. It's a condition, one of many chronic illnesses, and it's a pathological process of the heart. And so, what I want to do is share some information with you about congestive heart failure. What is it? How do we detect it? How do we determine if we have symptoms related to congestive heart failure? And more importantly, how do we prevent it or reverse it if we're diagnosed with congestive heart failure? My talk today is going to be very brief. I'm getting ready to go into the clinic to, ironically take care of a lot of patients with congestive heart failure. So, but I want to leave you with some clinical pearls now. I think it's important and I think it's timely to do so. So, first of all, what is congestive heart failure? Um, Congestive heart failure is a chronic illness that I should say is all too common. Heart disease is a broad scope of illnesses. And so when someone says, well, I have heart disease, what does that mean? Well, in general, it's a general term that means any disorder that affects the normal functioning of the heart. It doesn't necessarily mean you have heart failure if you have heart disease, but heart failure is often the end point of people with heart disease. But it's any disorder. So it could be high blood pressure, it could be coronary artery disease, it could be, inflammation, associated with arthritis or some other systemic illness can, yes, affect the heart. So any condition that can have an abnormal function on the heart can lead to heart disease. So we consider normal heart function. And so if we want to talk about heart failure, we want to think about how the heart functions normally. So here are a couple of brief slides I want to share with you. And some of these slides look a bit more complex than others. The purpose is so that you can have some information. You can go back and take screenshots of this and read it more carefully. But in summary, the heart works like a pump. It beats about 100,000 times a day. The two sides of the heart, we often think in terms of left heart failure or right heart failure. The left heart, the left ventricle, left atrium, it circulates blood to the systemic part of our body, to our brain, our arms, our abdomen, our legs, etc. The right heart receives blood that's low in oxygen. So the left heart receives blood that's high in oxygen from the lungs. The right heart receives blood that's low in oxygen from the body. So when the blood is circulated to our body, to our brains, our arms, our legs, our GI tract, our left big toe, right big toe, that it nourishes the body. It nourishes with oxygen and nutrients. And then the body then in turn returns carbon dioxide to the blood, and it goes back to the right side of the heart which is the right upper and right lower chamber, and it sends the deoxygenated blood to the lungs. And then the lungs then take the carbon dioxide. You take a deep breath, you breathe oxygen in, the oxygen goes into the blood, and then you breathe the carbon dioxide out. So that gas exchange happens in the lung. So then once the blood comes through the lungs, it goes back to the left side of the heart. Then it goes out with low carbon dioxide, high oxygen, and that cycle goes on and on. Another little footnote: before the blood goes to the right side, it passes through the liver. So nutrients that come from the GI tract or anything that comes through the mouth is broken down, manufactured in the liver, and that gets into the blood. So that's where the nutrients like protein and enzymes and other things are circulated around the body. So those are the basic components of heart failure. The heart has its own circulatory system. It has coronary arteries, the main arteries on the left, main arteries on the right. And this is how the heart circulates or nourishes itself with oxygen. If one of these arteries to suddenly become occluded, then you have what's called a heart attack, because when a certain amount of the heart muscle tissue is not getting blood, it dies acutely if that closure happens, that supply is cut off acutely. The heart also has its own electrical system. As an electrophysiologist, I've done a lot of work with the electrical system of the heart. Heart has its own God-given pacemaker. We call that the sinoatrial node. It has a filter between the upper and lower electrical circuits. We call that the AV node. And then it has wires that go throughout all the heart muscle cells. And the heart electrical system allows the heart to contract in a synchronized, organized fashion. This is very important because if the heart contracts in a synchronized fashion, it allows the blood to circulate in an organized manner. You may have heard of different types of electrical abnormalities, such as atrial fibrillation or atrial flutter. It's when the upper chambers don't beat in an organized manner. So the upper chambers, they contract normally and sequentially, then flow circulates from the upper to the lower chamber in an organized fashion, and then likely from the lower chamber to out to the circulation, either systemically or in the lungs in an organized fashion. However, if the upper chambers are not organized, contracting in an organized fashion, the electrical circuitry is short circuit, so they may be in like atrial fibrillation, then instead of contracting, they're fibrillating. So they're fibrillating, so blood's not circulating. So several things happen. Circulation is impaired, so the ability of the heart to circulate blood throughout the body is impaired. We're going to talk about that component in just a minute. But also you can form blood clots and predispose to stroke. So electrical circuitry, electrical system, I should say, of the heart is very important in terms of how it helps the heart function in an organized fashion. So how can the heart malfunction? Well, there's a condition known as coronary artery disease, as I alluded to earlier. If you have narrowing, a plaque, or fat buildup in the arteries, it impairs blood flow. If one of these plaques rupture and it causes a closure of the artery, it can lead to a heart attack. You can have diseased valves. Valves tend to be scarred due to inflammation. If you put toxic things in our system, high blood pressure can lead to scarred, worn down valves. Valves can be either too tight or be too leaky. Either way, they put undue stress on the heart to circulate blood from one chamber to the next. And then it creates a condition where the heart weakens over time. Electrical disease, as I alluded to, too slow of a heartbeat, too fast of a heartbeat, tachycardia. Even if it's a normal rhythm, your heart beating too fast all the time. Let's say you're dehydrated all the time, your heart rate's always 95 to 100 beats a minute. Your heart's going to wear out over time. And that's how we put experimental animals in heart failure, just by pacing the heart at a fast rate, and over time the heart weakens. Or disordered electrical system, arrhythmias that occur on a regular basis can cause you to either die suddenly or weaken the heart over a long period of time. So again, the heart can malfunction by means of having primary disease, high blood pressure, diabetes, other systemic illnesses. And so those can cause disease or weakening of the heart muscle directly. There are systemic illnesses, things like infections, autoimmune diseases, other substances like alcohol, People who drink a lot, alcohol is a direct toxin to the heart muscle, so it can impair heart function over time. So it's a problem that's not uh, that's actually fairly common. The most common cause of death is sudden death. Heart failure is one of the leading causes of morbidity and mortality here in the United States. And the definition of heart failure, by and large, is simply this: it's not so much that the heart has stopped, it's not so much the heart's gone kaput. Those things can happen in the setting of heart failure. But fundamentally speaking, congestive heart failure is a situation where the heart doesn't circulate blood commensurate to the body's need. So, for instance, if you're running or walking upstairs or sweeping your kitchen floor, your body's moving, your muscle tissue needs oxygen, needs circulation, needs nutrients. So, as you exercise more, you need more circulation, more flow. And so when you're moving, doing things, even brushing your teeth, even walking to the bathroom to use the bathroom, all of that requires energy. All of that requires muscle movement. And those muscles need oxygen because oxygen goes inside the cells so that the mitochondria can form ATP. And so you create this function. So circulation has to pick up according to the needs. If you're walking slowly, you may need N units of circulation. If you then jog, you may need 2N. If you're sprinting up a hill, you may need 3 to 4N amount of circulation. So the more exertion you give, the more circulation you need, the more the heart has to work. Guess what? If the heart's weakened to a mild extent, maybe you don't feel it when you walk into the bathroom. Maybe you don't feel it when you're just doing, ordinary days of activity, active living. But maybe when you go on that long walk or jog up the hill that you used to go on, and all of a sudden you feel a little bit more winded. Wait a minute, am I getting old? Maybe. We're all getting old, older, I should say. However, you need to think, if I'm not able to perform at the level I was, say, 2 months ago, 3 months ago, don't just think I'm out of shape. If you're more fatigued, you get up and go, it's kind of, getting up and going out the door. Think, am I circulating? Is my heart working well? So these are some things, very subtle symptoms that can be very mild and subtle and sneak up on you. I've seen many patients come in with florid heart failure. Saw a 36-year-old man a few weeks ago, uh, uh, um, and florid heart failure, and saw somebody else, and they told me he had bronchitis, and I mean, he was congested. We had to give him IV diuretics and everything. But he didn't know he had heart failure till he walked in, and he was like, his heart was beating at 10%. Why? Well, I talked to him and say, over a year ago, he started feeling mild symptoms. Well, a little bit weak, a little bit winded, this, that, and the other. Blew it off. I'm out of shape. I'm getting older, et cetera, et cetera. No, these heart failure will sneak up on you. Okay. So mild symptoms, fatigue, shortness of breath, inability to carry out the activity. These are some early signs of symptoms of heart failure that you need to be aware of. Are you or a loved one? If you notice them, think about the heart. Now, there could be lots of other things, but think about the heart first and foremost. So, heart failure, as I said, it's very common. 6.2 million adults in the US. In 2018, there were 378,000 deaths. Sudden cardiac arrest is a common cause of heart failure. Over 300,000 people die suddenly, and it costs us over $30 billion to treat people with heart failure. So, what are some standard treatments for heart failure? I'm going to leave you with the standard treatments for heart failure. I'm going to come back and do a more extensive discussion on heart failure because, we at Montgomery Heart Wellness use a more natural approach to things, and there's some powerful ways, some powerful interventions to not only prevent heart failure but also halt it and also reverse it. Heart failure is a very difficult disease to treat once it's advanced, but there's some things that you can do to really not only prevent it but reverse it. So many people have been diagnosed with heart failure. Your doctor may have told you, well, there's no hope. You're going to die in 5 years. You're going to die in 2 years. That's not necessarily the case. And so stay tuned. I'll come back and talk about some natural interventions of heart failure, some regenerative therapies. So there's a lot of hope despite the fact that you may be diagnosed or may have the diagnosis of heart failure. Anyway, the standard therapy is medical therapy. There are lots of drugs, pharmacological agents that could be used for heart failure. Um, We also have surgeries. If you have coronary artery disease and heart failure, you may be offered bypass surgery or stenting. If arteries are blocked and they want to improve circulation to the heart muscle, you may get a coronary artery stent placed. As electrophysiologist, I've implanted thousands of defibrillators. Managed thousands of patients with heart failure. We would go in and determine whether someone is at risk for cardiac arrest. I've placed thousands of patients in sudden cardiac death, shocked them out just to test how their heart handles cardiac arrest. We've implanted defibrillators. I've seen many stories where individuals having their lives saved with defibrillators. So these therapies can be effective if used in an effective manner. Oftentimes, individuals who have advanced heart failure, who are beyond some of the standard treatment, may be offered what's called advanced therapies, either transplant. This device here is an LVAD, which stands for left ventricular assist device. If your heart's very weak, you can have one of these as sort of a mechanical pump, sort of left to help out the left ventricle. The left ventricle is important because it helps circulate blood throughout the systemic part of the body. And so these are some of the things that are used for treating heart can benefit from at least knowing. And so hopefully that gives you a little bit of insight in terms of what heart failure is. Hopefully this video can be helpful. Again, we want to send our condolences out to the family of Mr. Harry Belafonte. He's a great human being, and he'll be missed by society around the world. But I want to use this opportunity to not let his death go in vain from the standpoint of the diagnosis of heart failure. It's bringing everybody's attention to this subject, and it's a very important topic for us to be aware of. So stay tuned for our next topic down the road. We'll be talking about congestive heart failure. Also, tonight, those of you who haven't gotten a notification, I'll be giving some updates on Jamie Foxx's condition. I spoke to a colleague of mine, and he gave me some interesting insights in terms of other things that we need to consider. There's not much news coming out. However, the latest I heard has been positive, but there's some other information I want to share with you. We'll be going live, I think, 6 p.m. Central Time, so you don't want to miss that tonight. If you do, don't forget to subscribe to the channel. So if you miss it, you'll get a notification. You'll be able to go back and look at it. Also, hit the thumbs up button and share this with any and everyone you think would benefit from this. So anyway, until next time, you take care, and I'm going to head to clinic.